Hello, my name is Diwakar Kinra, and I'm an endodontist in private practice in Flint, Michigan. In this webcast, we're going to discuss a very interesting topic that many general dentists struggle with in private practice, especially those who have recently entered the workforce, and that is case acceptance, or basically getting the patient to say yes to the treatment plan. In our last webinar, we discussed the details of diagnosis. And at the end of that discussion, we came up with a plan of action to help resolve the patient's chief complaint. Now, when patients are in pain, this can be a real motivator on getting them to accept your treatment plan. But there are many cases when this simply just isn't so, or that the patient is looking for what they think is the cheapest solution, and they think extraction is that solution. Now, if we haven't educated ourselves on root canal therapy and are anxious to present that in the treatment plan, then we too may lean towards extraction versus saving their natural dentition. After we have educated ourselves on the treatment, we for sure have to educate the patient on saving the tooth and go beyond seeing the short-term cost savings of extraction and the long-term costs and effects that would have on the oral health and overall quality of life. As population ages and people are tending to keep their natural dentition for a longer time than in previous generations, these groups also tend to have a greater amount of disposable income and are willing to spend it on their teeth. Many people are self-motivated to save their natural dentition, others not so much. Quality of life is rated high on importance to seniors as they age. Patients who lose their natural dentition tend to gravitate towards more cariogenous food due to its texture and ease in chewing, leading to more tooth loss and weight gain, which eventually lead to a lower quality of life. This information needs to be portrayed to your patients, and for those of us who are uncomfortable with these types of discussions, I suggest you do this in a pre-scripted format to fit your personality. As we discussed, in many cases, patients decide to just extract and leave it alone. Therefore, once you have educated the patient on the importance of saving the tooth, we need to present them with a comprehensive treatment plan that will address all of their oral health needs. In most situations, it's actually very difficult to raise the patient's dental IQ. Therefore, it's more pertinent to raise awareness. What does this mean? It's really just a systematic approach on how to present cases to the patient. You need to make the patient aware of their, one, current condition. In many cases, the patient don't really even understand what's going on in their own mouth. Two, what will happen if they take no action, otherwise known as future consequences. And three, which is lastly their treatment options. You will be surprised at how many patients don't understand that there is more than one approach to their dental concerns. It really all comes down to one thing: fit. How does this dental work fit into the patient's life? And that depends on these factors. Patient values. It's difficult to change the way they value dentistry, but you can change the way they value you. And if you gain their trust, they will value what you and your ability to help them gain awareness. Life situation. People are not driven about what's going on in their mouth, but what's going on in their life. If you understand this, then you can find a way to fit dentistry into their life scheme. Many dentists don't take the time to find this out, and they will eventually fail in gaining acceptance to their proposed treatment. So what are our goals in overcoming dentistry not being part of the patient's overall fit in life? First, we must define the obstacles. One, interviews and clinical exams give us all the information needed to make the case presentation. Two, focus on the patient's specific obstacles. More than just money, in many cases it's time, emotional concern, and location. Remember, you are the dentist, and in many cases we focus so much on the technical aspect and forget that we are speaking to patients and not our colleagues. Therefore, do not speak dentist, speak patient. Now, if we look at this slide together, you will notice the arrangement of the treatment planning table. This guide is to map our patient's level of awareness and oral disability. And in each combination, we'll define a stage that your patient is currently in. Let's go over the stages in this chart, and later we will discuss what the stages mean and how we move or upgrade our patients through these stages to acceptance. As you can see on the x-axis, we have oral disability, and on the y-axis, we have awareness. Each is divided into no and yes. So stage 1 in the upper left is comprised of no awareness of their oral condition, but also no disability. Stage 2 is that they have awareness of what's going on in their mouth, but no disability. Stage 3 is that they have a disability or even possible pain, but no awareness of where it's coming from or what is the cause. Stage 4 is that the patient is totally aware of the disability at hand. Let's define those stages as they pertain to the patient population. Stage 1 is cluelessness. Stage 2 is apathetic, meaning they are aware but don't care. Stage 3 is aggravated, discomfort but not sure where from. Stage 4 is compelled, discomfort, and what it is. Each of these stages can be different for everyone since these stages are subjective, and it is your goal to determine which stage your patient is in. And when it comes to level of readiness for the patient to say yes to treatment, it goes something like the arrow seen here. The most ready is stage 4, and it decreases as we have patients falter towards stage 1. How do we get our patients motivated to move stages? Well, you have to pique their curiosity, provide illustrations, and give them truthful consequences if no action is taken. Lastly, show concern for their oral health and how it affects their quality of life. Curiosity. Let's take a look at an example of a dialogue between a patient and me when discussing their ambiguous pain. John, did you know that you have an infection associated with your upper left molar? Here are some pictures of the pus pocket. Many of my patients have problems when they let this condition get worse. That can lead to discomfort, tooth loss, and affect many teeth around that one. Does having future pain concern you? Now, don't associate the dental condition with them. That way it looks like they have the ability to fix it and that you are not blaming them. And remember, curiosity breeds curiosity, which leads to conversation. Give them hope, painless, quick, and cost-effective procedures. Once the patient has hope versus overwhelming them, then discuss the cost. Illustrations are a great way to explain to the patient about their current condition and should be done in a very systematic manner. It can be laid out simply like this. This is what I see, this is considered ideal, and this is what can be done if it's a concern to you. This is what will happen if we do nothing. Most people are visual, so use as many visual aids as possible. If we look at this example of tooth wear, if the dent is showing, tell them they have worn off 1/8 of an inch of the hardest substance in the human body. It will get worse, teeth will get shorter, but then give them hope that you will be able to restore their dentition. And don't forget that visual aids adds an emotional component to their decision making and can really benefit you in motivating that patient to move them to a more complete awareness and getting them to say yes to treatment. Finally, the treatment plan. And remember that the sequence of discussion may not be the sequence of treatment, but it should include photos, radiographs, and a short explanation as we discussed before. Now, the comprehensive treatment plan in many cases has not anticipated the need for root canal therapy in the past because of a lack of endo diagnosis. And when it does come up, it will really throw a wrench in financially to the treatment plan, sometimes leading the patient to abandon the plan altogether. So we must account for this in our overall plan, even if it's borderline, and if not needed in the end, it will seem like a bonus to the patient. After the treatment plan, you need to summarize and remind the patient that you are willing to split up the treatment plan if possible. Spread out the cost, and both of these will show that you care. In your summary, remember not to give them a grocery list because people will try to negotiate and pick and choose their treatment. Put the ball back in their court by asking them, how long do you want this treatment to last? How fast do you want it to go? Discuss the phases of treatment and then clear up confusion. Finally, fees. Many patients will get sticker shock from the price of comprehensive treatment plan, and that's why fees are discussed at the end. Otherwise, you are not having a treatment plan, but a money plan. This is an emotional event, and remember that for every patient, $5,000 is expensive, $500 is expensive, and even $50 is expensive. Ask the patient, how do you want to finance your decision? Cash, check, or even care credit? And when given the chance, people love deals. So offer one, a discount with cash or check, or a discount if a portion of the treatment is paid up front. People want to feel like you care, and this is a great way to show them that. And notice how we didn't mention insurance? You have to get that out of yours and your patient's mindset, and use insurance as a discount to maximize their benefits. In some cases, the sticker shock will scare the patient from treatment, and the out-of-pocket cost is not affordable. Well, make it affordable with patient financing. One example is Care Credit. Become familiar with Care Credit website and customizable worksheets. This really helps visualize the treatment plan financially and does a great job breaking that very large unaffordable payment to a more reasonable monthly payment that patients are more amenable to. And monthly payments are what most patients have in their life when it comes to their house mortgage, vehicle leases, and payments as such. But in the end, it all comes down to this when fees are associated with treatment. Every dentist has an emotional limit on what they are comfortable presenting to the patient when it comes to a total treatment cost. So if you are comfortable presenting a $900 treatment plan, you'll adjust accordingly so that treatment plan falls in that range. If you are comfortable presenting a $5,000 treatment plan, your presentation will be much different. My suggestion is that you need to get comfortable presenting a fee that will allow you to present an overall plan that will benefit your patient's oral rehabilitation and maintain them there for life. Well, our time together has come to an end. It has been a pleasure sharing this information with you, and I hope to visit you soon again, either live or online. Until then, this is Diwakar Kinra wishing you a great success in your future endeavors.